There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: my age is 20 and I have low blood pressure. How can I get rid of it? Answer by Reuben Fogg. Low blood pressure is defined primarily by signs and symptoms of low blood flow and not by a specific blood pressure number. Some individuals may have a blood pressure of 90/50 with no symptoms of low blood pressure and therefore do not have low blood pressure. However, others who normally have high blood pressure may develop symptoms of low blood pressure if their blood pressure drops to 160. Signs and symptoms of low blood pressure: dizziness, fainting, chest pain similar to a heart attack are signs to watch out for. In extreme cases, when triggered by a shock, persistently low blood pressure causes organs such as kidneys, liver, heart, lung, and brain to fail rapidly. Causes of low blood pressure: low blood pressure or hypotension can be caused due to many factors. Common causes of low blood pressure are dehydration due to vomiting and diarrhea, exercise, sweating, fever, exhaustion or heat stroke. It can also be caused due to moderate or severe bleeding. Another cause for low blood pressure can be inflammation of organs. Acute pancreatitis, inflammation of the pancreas. Treatments for low blood pressure. For many people, chronic low blood pressure can be effectively treated with diet and lifestyle changes. Depending on the cause of your symptoms, your doctor may tell you to increase your blood pressure by making these simple changes. Answer by Leanne Heisey. Medically speaking, one's blood pressure is only seen as too low if it causes symptoms, usually dizziness, feeling faint, collapse. We don't treat number, we treat people. So if you're feeling okay on the blood pressure you have, no need to do anything about it. It's just part of you. On the other hand, if it usually is higher, then you should see a competent doc. Not need for a specialist. A good GP is fine to discuss if anything has changed. For one patient I knew, very positive, retired, so less stress. Other could be dehydrated, had heart problems, etc. etc. Or if you're on antihypertensive drugs, you need to take less. Know that doctor's office blood pressure measurement are 5 millimeters Hg higher than those taken at home using the same machine. And then what is the low blood pressure? What are the numbers? How is it measured? Is the blood pressure monitor used a validated one? Using the usual El Cheapo ones that aren't validated, you don't know what the results mean, by whom, how often repeated, is the technique measuring blood pressure correct, etc. etc. The values we've agreed upon are for those measure when sitting, since blood pressure standing less than sitting less than lying down. Also, the correct positioning of the arm at the heart's right atrium level is important, since when it is lower than the heart, the blood pressure will be 5 millimeters Hg higher than the true values measured correctly. See, both body and arm position significantly influence blood pressure measurement and the effect of different body positions on blood pressure. Video: how to measure blood pressure using an automatic monitor. The Dutch GP Associations recommends to repeat measuring blood pressure 3 times. Take the two values nearest to one another. In truth, they should be within 5% of one another, and take the mean values as the true value of that moment. In practice, we only do this when the first value is outside the expected range. If the monitor used hadn't been validated, get a validated one. The ones available for public use in the drugstores when examined couldn't pass the certification. A list of validated blood pressure monitors can be found on Dable Educational Trust vertical bar monitors for self-measurement of blood pressure, SBPM. In some very skinny people, their usual, so not abnormal, blood pressure is relatively low when compared to others, who have a bigger arm. Since the way blood pressure using a cuff is measured is influenced by how big the arm is and if the cuff used was the right size. We'll comment further when you give the actual measurements using a validated machine, used the right way. See the Mayo Clinic video link above. Answer by Dr. Sonal Priya. Symptoms of low blood pressure are dizziness, spinning sensation when you stand up. Get your blood pressure checked rather than being your own doctor. Some tests which the physician would do are repetitious blood pressure checks after you stand up from a sitting or a sleeping position, or an ECG, or monitor your blood sugar level. Show the doctor your past medical history and the current medications which you are under to check if any of these are causing low blood pressure. Apart from what the physician recommends, some tips to counter low BP are: drink a lot of fluids, avoid alcohol, avoid caffeine especially at night, regularly exercise to control your blood flow, avoid lifting heavy weights, avoid standing for long durations, Avoid exercising which you need to stand up quickly and repeatedly like squats. Your sleeping posture should be a 1 with your head raised slightly. Avoid long duration of hot showers. Keep yourself safe in the bathroom. Eat smaller meals. Rest for some time after each meal.